Now let's study about the joints of the free lower limb. We'll study one of the most important joints, hip joints. The first type of it is also belong to a ball and socket joint, but this ball is bigger and the socket is bigger also, not like the shoulder. The ball is big, but the socket is small. And in hip joints, ball and socket very big together. Then is composition of it. First, the ball is the femoral head, and the fossa or the socket is acetabulum. Acetabulum. If you forget this structure, please see the hip bone on the lateral side of the hip bone, or between ilium, pubis, and ischium. There is a big fossa on the lateral surface of hip bone. This one is acetabulum. Acetabulum is the fossa. This one is the head. The two surfaces will form hip joints. The characteristics of it. First one, the head is very large, and the fossa is very deep, and also the height is nearly totally enclosed or covered by the fossa. So this joint is very strong. At the same time, it's not very free like the shoulder, because the fossa is very deep, enclosed totally surface of the head nearly. The second one, around the fossa, around the acetabulum, that also has a labrum. Now you see, here is the acetabulum, around it there is the labrum. It's like the glenoid labrum of the shoulder joints. At the same time, this labrum also can increase the area of the fossa and the depth of the fossa, makes these joints stronger. The third one, in these joints, there are some intercapsular ligaments. Intercapsular ligament means these ligaments, they are in the capsule, in the cavity, in the joint. First one is ligamental femoral head. You see this one. These ligaments, one side, or lateral side, connect with the head of the humerus. Not humerus, femur. Another side connect with acetabulum. Okay. So this limb connects your hip bone and femur. The second one is transverse acetabular ligament here. Transverse. The transverse acetabular ligament is blocked acetabular notch. You know, on the inferior border, here, inferior border of the acetabulum, there is a notch. And now, this ligament blocked this notch. So, now the acetabulum will form a total circle, not any notch. So, make this fossa more stronger. Also, all the structure make this ligament, make this joint stronger. The fourth one is there are not only intracapsular ligaments, but also have many extracapsular ligaments. Extracapsular ligament means all these ligaments is around the joint. And there are three extracapsular ligaments. First one, iliofemoral ligament. Ilio means this ligament is from ilium. You see the top is the ilium. From the ilium, then go downwards to the head of femur, iliofemoral ligament. Second one, pubofemoral ligament. Pubal means the pubis here, the pubis. From the pubis, then go laterally to the height of femur, pubofemoral ligament. And you see on the back, here is the back of the hip. Here should be the ischium. Okay, here the ischium. from the ischium, then go laterally to the height of femur. This one is ischiofemoral ligament. Okay, now you see the three ligaments. They are from ilium, pubis, and ischium, the three bone of the hip, from three different parts, three different directions, finally, and on the neck of the femur, from three different directions, enclosed around the joints, make the joint stronger. Okay, now let's see the fifth one. The joints, the hip bone, the hip joints, the capsule is strong and dense, not like the shoulder. The shoulder, can you remember? What's the shoulder capsule? Yeah, is thin and loose, but here is strong and dense. And all these characteristics have a relationship with anatomic structure and has a relationship with the function. You know, the upper limb, we use it to do many actions, and the lower limb, we can walk. At the same time, there is another important function: transmit the weight from the upper body to your lower body. So the lower joints must be strong and dense. But you see the posterior and the inferior parts. This part, there is no any ligament. At the same time, the capsule on the inferior and posterior part is loose. So the dislocation of hip joints often happen on inferior and posterior part. The dislocation often happening here. Okay. Now let's study about the movement of the hip joint. First one, you see is our the right leg. Move forwards is flexion, move backwards is extension. Continue to backward is hypoextension. The right leg move, here is the left leg. Move laterally, abduction. Move medially, adduction. Also can rotation. Rotation is also along the vertical axis. All the lower limb can move around this axis, move medially and laterally is rotation. The last one is circumduction. It's a round movement. Hip, this part don't move, and this part will move around the circle. It's circumduction. Okay.